This is an interview with Miss Pamela Ericson, and she make interview about the treatment with the sodium bicarbonate that could eliminate the tumor from her bladder. Now we are in February 2022. So let's go on. She can start. Okay, go on, Pamela.
Hi, Dr. Simoncini. Hi, everyone. My name is Pamela Ericson, and today is February 15th of 2022. Back in March of 2020, I was diagnosed with bladder cancer. Here's the sheet, and I've kind of circled there. Bladder cancer. So after that, I had 2 transurethral resections of my bladder, or for short, they call them TURBT, to scrape the cancer out of my bladder and get me ready to be able to have this BCG treatment. So I had 2 of those procedures and then proceeded to have the BCG, but within a month to 6 weeks, everything was back and all of my symptoms were back. I then went to a cancer center and had another transurethral bladder, and that is this. They came up with the same diagnosis of cancer, aggressive cancer in my bladder. So then in January, the doctor's first option for me was to have my bladder removed. It is then when I decided to contact Dr. Simoncini, and I did his protocol using the sodium bicarbonate, and I did that for, it was a few months, from January, into April. And I followed his instructions and I did everything. And then in April, I asked to have a CT urogram, and that CT urogram showed no cancer. I then was instructed to go and have another TURBT because to be sure. So then in July of last year, 2021, I had another TURBT at the cancer center, and here's my results. Bladder normal, no cancer. Since then, I just was rechecked with a sonogram the 20th of December of 2021, and that was clear. And in January, I had a office cystoscopy, which was clear, and my urine also tested, all the markers were clear. So I just am so grateful to God and to Dr. Simoncini. This just shows me, that there are other ways to look at cancer, and I'm very grateful to God and Dr. Simoncini, and I hope that I can help someone to be able to think of different options for their own health. So I'm very grateful, and God bless you in your journey. Thank you.
Thank you, Pamela.
How was that?
That way you will help other people, because you show that my method can be effective on cancer. So I thank you, and I hope that other people will look beyond the conventional treatment, especially when the treatment are risky and harmful. Thank you, Pamela.
Thank you, Dr. Simoncini. Thank you. I'm so grateful. God bless you, and thank you again.